Hi, my name is Dr. Eric Arzubi. I'm a child and adolescent psychiatrist, and today I'm going to be talking to you about eating disorders in adolescents and what every adult needs to know. So here's a number that should alarm every parent, teacher, and healthcare worker. Emergency department visits for eating disorders doubled among teenage girls during COVID-19. And those numbers, they're still rising in 2025. We're facing a crisis that's pretty much hiding in plain sight. About 1 in 4 of children and adolescents worldwide now show signs of disordered eating. That's more teens than have type 1 diabetes. And yet we routinely screen for diabetes while missing eating disorders entirely. But here's what does give me hope. Early detection can save lives. When we catch eating disorders within the first 3 years, recovery rates jump to 90%. The challenge? Most teens wait 2.5 years before getting help. Let's start with what we're actually dealing with. Eating disorders now affect up to 3% of all adolescents. That's roughly 1 student in every classroom of 40 kids. But only 10% receive treatment. The demographics might surprise you. While females are affected 2 to 3 times more than males, transgender youth face the highest risk at 12%. Native and indigenous teens show 12% rates, and LGBTQ+ youth face 3 times the normal risk. Then there's a condition many people haven't heard of, ARFID, ARFID, which represents Avoidant Restrictive Food Intake Disorder. It affects nearly 2% of adolescents, almost as common as anorexia itself. Unlike other eating disorders, ARFID has nothing to do with body image. Instead, teens develop extreme sensitivity to food textures or fear of choking. The reason this matters? Eating disorders have the highest death rate of any mental health condition. 1 death every 52 minutes. Yet half of all cases go undiagnosed. So, how do we spot these disorders early? The signs fall into 2 categories: physical red flags and behavioral changes. Physical warning signs that need immediate medical attention include a heart rate below 50 or above 110 beats per minute, significant blood pressure drops when someone stands up, weight loss exceeding 10% in 6 months, or body temperature consistently below 97 degrees. Behavioral patterns are often easier to spot in daily life. Watch out for progressive food restriction, like eliminating entire food groups or developing rigid eating rituals. Social withdrawal becomes common as well, especially avoiding meals with others or declining social events that involve food. Exercise becomes compulsive, like training throughout injuries or showing distress when unable to exercise. For ARFID specifically, look for extreme sensory sensitivity like gagging at certain textures or fear of choking. Unlike anorexia or bulimia, teens with ARFID show no body image concerns. There's a simple 2-minute screening tool called SCOFF, SCOFF. Ask 5 questions. Do you make yourself sick? Worry about losing control over eating? Lost more than 14 pounds recently? Believe you're fat when others say you're thin? Would you say food dominates your life? 2 or more yes answers warrant immediate further assessment. Now, we can't discuss teen eating disorders without addressing social media's role. The numbers are stark. 80% of teenage girls report Instagram negatively affects how they see their appearance. TikTok presents an emerging threat, with 55% of users reporting negative body image impacts. Heavy users spending over 2 hours daily approach clinical eating disorder thresholds on standardized tests. Now, here's a crucial pattern. Each additional hour of social media use directly correlates with increased fear of weight gain and compensatory behaviors. High usage teens have up to 2.5 times greater odds of developing eating concerns. The platform's algorithms make this worse. Users seeking weight loss content receive increasingly extreme recommendations, creating what researchers call vicious cycles where vulnerable teens are fed progressively harmful material. But there's also a protective factor. Teens with high media literacy show reduced susceptibility. Those who study social media critically in school demonstrate better body acceptance and less comparison behavior. Now for the hopeful news. We have treatments that work. Family-based treatment, or FBT, is the gold standard. It achieves 30 to 50% full recovery at treatment end. And it can continue to stay consistent up to 40% or 49% at 12-month follow-up. And you can compare this to just 23% recovery with individual therapy alone. And here's another milestone that families should know. You get 2.9% weight gain by the fourth session, that's roughly 5 pounds, and that predicts successful treatment outcomes. This gives families a clear progress marker. FBT costs about $9,000 compared to $18,000 for other family therapies, achieving faster weight restoration in the first 8 weeks. For medical management, the key is avoiding refeeding syndrome, a potentially fatal condition when severely malnourished patients eat too much too quickly. Treatment starts at 50% of normal calorie needs, with daily monitoring of crucial minerals like phosphorus, magnesium, and potassium. Now, here's a reality check about medications. There are no FDA-approved medications for eating disorders in teens. The focus must be on nutritional rehabilitation and therapy. Recovery takes time, but persistence pays off. Overall, recovery rates are 46% across all eating disorders, and improving up to 64% at 8 to 10 years and 67% after 10 years. If you work with teens, here are your immediate action steps. First, you can screen annually using the SCOFF questions. It takes about 2 minutes. 2, monitor growth patterns, not just weight. Watch for teens crossing 2 or more percentile lines downward. 3, change how you communicate. Use person-first language like person with anorexia, not anorexic, and focus on behaviors, not weight. Say, I'm concerned about your eating patterns, not comments about appearance. And that gets to my 4th point, which says avoid all appearance comments entirely. So know when to refer immediately. Any vital sign problems, severe weight loss, suicidal thoughts, or when your management attempts fail after 4 to 6 weeks. Don't just ask about screen time. Ask what content teens consume. Weight loss content and appearance-focused material predict harm more than usage duration. Remember this, you see adolescents regularly when parents might miss gradual changes. You have credibility to express medical concern. You can be the bridge between suffering in silence and life-saving treatment. Eating disorders are not choices, phases, or attention-seeking behaviors. They're serious medical illnesses with the highest death rate of any psychiatric condition. But with early detection and evidence-based treatment, recovery isn't just possible, it's probable. Early intervention within the first 3 years can achieve up to 90% recovery rates. Every day matters. Your vigilance and action today could save a life tomorrow. This crisis is real, but so is our ability to respond. When we know what to look for and act quickly, we can help teens not just survive these disorders, but fully recover and thrive.